Part 2. So why we are insisting upon the traditional protocol? Kottakkal Ayurvedishala is a 125 years old institution. We are manufacturing classic traditional Ayurvedic products, mostly herbal products. And in our clinical practice, we find most of these yogas are very, very effective in managing various chronic diseases. People are going behind the modern medicine and ultimately they are coming back with no result at all. So such chronic type of cases, we are able to easily manage with our clinical traditional herbal products. But the younger generation of Ayurvedic doctors are not aware of the efficacy of the traditional products. They are running behind the patent medications. So instead of that, this is our effort, bring back them to the traditional line, which is more effective, promising, easily, fast curing also. So in this series, this part 2 of the GRITHA, I will be talking about. My humble pranams to our Lord Vishwambara, P.S. Warrior Sir, and Madhava Warrior Sir, and our great Guru, Padma Bhushan, Dr. P.K. Warrior Sir. Was the managing trustee for our institutions for more than 60 years. He is the guideline for all our thoughts and works and everything in Ayurveda. He is a person of pure Ayurveda concept. But he is quite aware of the modern medical development and integrate it whenever it is required. So today in the first this thing, I will be talking to you about the Amritaprasa. I don't know how many of you have used this yoga. Amritaprasa is from Ashtanga Hridaya. I think Kasa Swasa or Rajayakshma Chikitsa, where the Brahmana is indicated. See the ingredients. So Swarasa of Dhatri, Vidari, Ikshu, and Kshira, Chagamamsarasa, and for the Kalka, Jivaniya Gana, etc. 35 drugs, including various types of fruits, Draksha, Choda, Dijabhalam, Madhurasnigdha Brahmanam. That is the classical slogan. Draksha, etc. Fruits which are Madhurarasa and Snigdha in quality and Brahmana also. You have to add all this fruit juice into the preparation of this Amritaprasa. And in the Pratrapaga, you have to add Madhu Sita, Maricha, Tok, Ela, Nagakesara, etc. Please keep it in your mind that this is a non-vegetarian product, not vegetarian product. So you have to be very careful while recommending this product to the vegetarian. शाकाहारियों को जो prescribe करते हैं ध्यान से रखने का. So दूसरा हमारा non-vegetarian product कोई है क्या आपको मालूम है? हमारा जो blood छागलादि घृतम है ना, वो contains छाग मांस रसा, और अजास्वगंधादि अवले, that contains the छाग मांस रसा again. So these are the few of the major products which are non-vegetarian. And comes our Maha Kukkuda Namamsa Taila, Maha Marsha Taila, etc. That is a Taila category I am talking. So for the vegetarian, Shakahari लोगों को ये prescribe नहीं करने का. दूसरा बात है कि ये तो इसमें मधु और सीता है. So diabetic patients को भी लिखना मुश्किल है. Those who are having below 150 maintaining diabetes blood sugar level, you can very well try. But 100% please do not recommend for the people having 200 and above blood sugar level. So इसमें जो लिखा है नट्ट शुक्ला. So नट्ट शुक्ला, जिन लोगों को sperm count है कम है, ejaculation में sperm volume का कमती है और erectile dysfunction है, ये सब के में नट्ट शुक्ला, क्षतक्षीणा, व्याधिकर्षिता, and those who are having the weakness, emaciated, chronic fatigue syndrome after the modern medical treatment, hospitalization, or due to various other conditions also. nowadays with the corona, after corona or after dengue, chikungunya and everything, so many people are complaining about the kshinata, dhatu kshina avastha. So such condition, once the digestive power is capable enough to digest the ghrida, you can very well recommend. Stri prasakta, that means those who are having regular sexual action by which their sexual weakness end up, erectile dysfunction and all the other things. So Nashta Shukla and Stri Prasakta. 2 points. Male infertility also, this is very, very effective. And people are, those who are having the honeymoon type cystitis and before the immediately after the marriage, both male and female lacking the sexual interest, to boost the sexual feeling, this Amritaprasa found to be very, very effective. And for singers, it is called Varnaswara Hinamscha Brahmai. It is very effective for the singers, regular use, to improve the ability of the vocal cord and clarity of the voice. संगीत जो पढ़ता है उन लोगों को स्टेज परफॉर्मेंस सब देते हैं ना, लोगों को ये अमृतप्राश एकदम रेगुलर लेने के वास्ते ये वोकल कॉर्ड का एफिशिएंसी बढ़ जाती है. And to improve the lung capacity, especially the post corona condition में lungs का capacity कम हो जाता है, उन लोगों को रेगुलर यूज करने से लंग कैपेसिटी बढ़ जाता है. एंड टू इम्प्रूव बॉडी वेट आल्सो, दिस इज वेरी गुड. लीन पर्सनालिटी लोगों को भी ये रेगुलर यूज करने से बॉडी वेट बढ़ जाते हैं. ओनली थिंग अवॉइड इन डायबिटीज. जिन लोगों को सेक्सुअल रिलेटेड प्रॉब्लम है उन लोगों को वसंत कुसुमागर के साथ देना बहुत अच्छा रिजल्ट है. सो और इसके अलावा स्वर्ण भस्म, सिद्ध मगरध्वजा और सुवर्ण मुक्तादि टैबलेट है, ये सब मिला के देने से अमृतप्राश को सेक्सुअल रिलेटेड प्रॉब्लम में ज्यादा तरफ इफेक्ट देखा है हमने. एंड हृदरोगा एंड मूर्छा वी डोंट नीड. मूत्र रोगा, योनि रोगा, vaginal diseases and urinary infections, टाइप ऑफ डिसीजेस, ये सब कंडीशन में अमृतप्राश बहुत अच्छे रिजल्ट देते हैं. सो मेल इनफर्टिलिटी, फीमेल सेक्सुअल प्रॉब्लम एंड मेल सेक्सुअल प्रॉब्लम्स, erectile dysfunctions and weakness, all these conditions, this Amritaprasa is very, very effective. Next comes the Trifala Gridam and Mahatrifala Gridam. Trifala Gridam and Mahatrifala Gridam has been mentioned in the Nayana Roga Chikitsa Ashtanga Hridaya. In Trifala Grida, Trifala Kashaya in milk and Kalka Trifala. And in Timira, Acharya recommends you can use it with honey or Trifala Kvada or sugar. And we have to add extra, but otherwise it is containing only Trifala, Kashaya and Trifala. So you can very well recommend it for the diabetic also. What is the difference between Mahatrifala Grida and Trifala Grida? Again, Mahatrifala Grida contains the Trifala Kashaya in it. And additionally, Bringaraj Swaras, Vasa Swaras and Ajakshira. For the Kalka, Estimadu, the two type of Kagoli, Vyagri, Pippali, Guduchi, Utpala, Draksha, etc. In Patrapaga, you have to add sugar. So Mahatrifala Grida cannot be recommended for the diabetic people. But Trifala Grida can be recommended to the diabetic people. That is the difference. You have to always keep it in mind. Both the yogas are highly effective in various types of ophthalmic diseases. Even otherwise also, Triphala, Sarvaroga, Kri, Metha, Ayur, Belavarthini, Rasayana, Adhikarana, it is told. And Netrame, Triphala, any kind of ophthalmic disease, Triphala is very, very good. In my practice, in the cities and all, we get allergy of the eyes. I recommend the Triphala Kada for the eye wash or Nayanadhara, Netra Dhara. That gives excellent result. Keval Triphala Dhara, Triphala Kashaya Dhara. And those who are having chronic ophthalmic complaints, you can add with Saptamrita Lauha or Triphala Gulgulu. One ophthalmic patient doctor told me recently, Ayurvedic doctor told me recently, जिन लोगों को ग्लूकोमा का कंप्लेंट है, ट्राइफला घृतम एंड त्रिफला गुलगुलू दोनों मिला के देने से बहुत अच्छा रिजल्ट है. Retinitis pigmentosa है and all other type of general eye disorders बहुत अच्छे हैं रिजल्ट. And Timira also in the early stage of Timira, not in the later stage. Early stage of Timira also this is very effective. Apart from this, I found it is Mahatriphala Ghrita is very effective in hair falling. Hair fall जो patient है, लोगों को Mahatriphala Ghrita 2 चम्मच 10 ml every day night देने से और अच्छा बालों का तेल भी दे सकते हैं, बहुत अच्छा रिजल्ट है. Anemia and hair growth of both male and female, anemia also, this yoga is very effective. This is another drug which we are using in the various types of ophthalmic disorders. Patoladi Ghritam. Again, it is mentioned in the Nayana Roga Chikitsa. You see, the Kashaya contains so many drugs: Padola, Nimba, Kadirogini, Darvi, Ushira, Trifala, Vasha, Dhanya, Dhanvayasha, Brahmi, Parpadaga, Amalaka. And for the Kalka, Musta, Bhunimba, Yashti, Kutaja, Ushira, Pipali. And it is mentioned, told that Vidradi, various types of Vidradi, Jwara, Pitaga, Visarpa, Kushta, Amladaha, that is Amla Pitta, and effective in the management of all type of ear, nose, throat, and eyes and everything. Shukla Roga, Timira, Nakta Anthyata. And you have to see that if you go through the ingredients, जो देखते हैं पित्ताधिका कंडीशन में इफेक्टिव है. पित्ताधिका कंडीशन में हमारा पास महातिक्ता घृतम है, तिक्ता का घृतम है, वो पार्ट 1 में आपको बताया. ये तो पटोलादि घृतम है और तिक्तरस है, सो मोर पित्तहरा. इसलिए शायद आचार्य ने कहा होगा अम्लदाहरम, अम्ल पित्त की जो बर्निंग सेंसेशन है, रिफ्लेक्स इसोफेगाइटिस, एसिडिटी, ऑल जिस कंडीशन में जो अम्लदाह आता है उसमें पडोलादि घृतम डेली यूज करना बिफोर फूड अच्छा है. And Vidradi, Pitaga and all these. My only concern is that various types of ENT diseases. I will tell you my one clinical experience. One patient aged about 80 years old, highly diabetic and hypertensive. She had an ophthalmic problem. Ophthalmic problem is nothing but because of her age and diabetic problem, the thin layer attached to the retina is gradually drying up and shrinking. Retina में attach हुई है thin layer जो है ना, वो gradually dry हो करके shrink हो रहा था. So patient used to see the piece vision. ये retinal detachment केस नहीं बोल रहा मैं, मेरा एक्सपीरियंस दूसरा है. रेटिना का जो आगे है जो लेयर है वो श्रिंक हो गई है. सो डॉक्टर को दिखाया, ऑप्थाल्मिक डॉक्टर को दिखाया, उन लोगों ने बोला ये स्पेशल सर्जरी है, उसमें वो लोग गैस डालते हैं रेटिना के वो एरिया में. सो गैस के प्रेशर के वास्ते शायद और लेयर अटैचमेंट हो जाने का संभावना है, नो गारंटी. I consulted one doctor, ophthalmic doctor, and got the opinion. What is your opinion? So he told me that, doctor, there is no guarantee in cure. If you want, you can very well try Ayurvedic products. Then I gone through the case history. So I thought Patoladi Ghritam will be the best solution for that one. I started giving 10 ml of Patoladi Ghritam every day at night. Only Patoladi Ghritam. So she continued the diabetic medicine, BP medicines and everything. You won't believe that after 1 month, she started showing the result. And after 3 months, complete cure of the condition. Complete cure. She was absolutely normal. Then continuously used for another 1 month and I stopped the medication. After 3 years, this slowly started coming back. Again, I tried 3 months course of Paddhati, cured again. So after that, no reporting of this problem. So this is the effect of this Paddhati in various types of eye disorders. And another thing is that diabetic related eye problems, eye diseases. Better than the Mahadiktakam and Tiktakam, Paddhati is found to be very effective. That reduces the blood sugar need, this thing also. Of course, retinal edema, retinal detachment also we can very well try. And we can use this yoga for the tarpana of the eyes. Tarpana Chikitsa is the tarpana Putabhaga. And Amrapita, Amradaha, you can add either Praval Basma or Shankha Basma along with this yoga. So do not forget, this is one of the best medicine for the ophthalmic problem. Those who are having diabetes, Trifala Gritha or Paddhati Gritha. Non-diabetes, Mahatrifala Gritha. And the next is the Dhatriyadi Gritha. Dhatriyadi Gritha is a Sahasra Yoga reference yoga, but it is very, very effective. It containing Amalagi, Vidari, Ikshu, Shatavi, Kushmanda Swarasa, etc. and Shira, Draksha, Yashti, Chandana, etc. as a Kalka, and there is sugar in that one. Pittadhiga conditions, all Pittadhiga conditions, you can recommend this yoga. So for Pittadhiga, again, we are Mahadittaga, Tiktaga, Paddhati and Dhatriyadi. Dhatriyadi is found to be more effective in Panduroga related complaints. Please remember, Dhatriyadi ये जो योग है ना, पांडुरोग अनीमिया के साथ जो आता है complaints, वो कंडीशन में ये अच्छा रिजल्ट देते हैं. असृद्धरा, पैतिक गुन्मा, अस्थिस्रावा, white discharge, and female infertility, रक्तपित्ता, especially female, अधोग रक्तपित्ता type, मूत्रगच्छा, mada unmada, maybe mada unmada type of condition due to the low hemoglobin level, and madatya. Madatya we don't have much choices. Madatya also alcohol related problems also. This is very, very effective. Inflammatory uterine conditions, various types of uterine discharge. For that, we have got another yoga also, Asoka Gridam. Shwedam, Pradaram, Neelam, like that he is told. Ashoka Grida is also very, very effective. And erectile dysfunction also, it is found to be very effective. Erectile dysfunction, early ejaculation, and bacterial growth in the sperm. Bacterial growth in the sperm. This yoga is found to be very effective. Blood in urine, especially after the intercourse, maybe from the male side or female side. Blood in urine. That is Rakta Pitta, it is told. Blood in urine, this yoga is found to be very effective. But only one point you have to keep in mind, those who are having Panduroga condition plus all other symptoms, this is more effective. And Dhanvantara Gritha, one of the famous yoga mentioned in Ashtanga Hridaya Prameha Chikitsa. So for the management of the diabetes, somebody is blocking my TV. Please, thank you. So in the management of the diabetes, Mutragraha Rija Gunmatchaya Dhyastvapatarpana, neuropathy has been mentioned, and Ayurveda also. They mentioned it is a Vatadiga condition. Mutragraha, Ruja, Mutra Ruja, Gunma, Shaya, etc. type of symptoms. This is nothing but an diabetic neuropathy only. So उसमें जो दवाई क्या दे सकते हैं? क्या दे सकते हैं हमारे? Somebody is playing in the screen. Please avoid. Please avoid. I am not able to read properly. Okay. So Dhanvantara Krida is the best solution for all these things. It is hypoglycemic also. Containing Dasamula, etc. 27 drugs. Remember that there is Balladaga in it. And Kalka, Vipari, Chavya, Vajcha, Nichula, etc. 10 drugs. So mainly indicated in Prameha and Prameha Pitaka. and Prameha related Pandu, Vidrathi, Gunma, and for useful in nourishes Shobha, Gera, Udara, Shwasa, Gasa, Vami, Vruddhi. I will come to each point. Pliharoga, Vada, Shonida, Kushta, Urmada, Pasmara. Again, coming to the diabetic neuropathy, Agni Mandya is a very common symptom in advanced stage of diabetes. Patients will not be able to consume the food properly, timely. उसमें क्या से दे सकते हैं? अंग्रेजी में क्या दवाई है उन लोगों के पास? कुछ दवाई नहीं है. अपने सर वो खाना पीना सब अच्छा करने के लिए. हमारे पास जो अच्छा दवा है उससे कोलेस्ट्रॉल नहीं बढ़ेगा, ट्राइग्लिसराइड्स नहीं बढ़ेगा, ब्लड शुगर कम हो जाएगा. धनोदर कृतम. Only thing you can add Ashtachurna with the Dhanvantara Kritam before food twice in the day, once in a day. Hingu Vachadi Churna or Deepagadi Churna, Induppu Kanam Churna. All things can be mixed with Dhanvantara Kritam and before food. I treated so many cases rejected by modern medical doctors. So within 2 weeks, 3 weeks, the patient will say that he is able to consume more food and weight also slowly increases. Malabsorption syndrome, even non-diabetic case also, absorption ठीक तरह से नहीं होता है. लोगों को भी ये दे देना बहुत अच्छे हैं. And as I told you, डायबिटीज में जो संधिवात के टाइप जो सिम्टम्स जो आता है वातशोणित डायबिटीज में जो जॉइंट्स पेन है, मे बी ऑस्टियोआर्थराइटिस है और मे बी लंबार डिस्क डिजनरेटिव डिजीज है और जॉइंट्स पेन है, उसमें आपको गुकुल पंचफलम मिला के दे सकते हैं. गुकुल पंचफलम चूर्णम है प्लस धनवंतर कृतम, वरना तो योगराज चूर्ण है हमारा कोटेकल का योगराज चूर्ण है, वो डायबिटीज में अच्छा रिजल्ट देते हैं, वो आर्थराइटिस में भी अच्छा रिजल्ट देते हैं, वो मिला के दे सकते हैं. यदि अनीमिया ज्यादा है तो मवाइश चूर्ण मिला के देना अच्छा है, और मंडूर वडगम भी मिलाओ और अन्नबेदी या लोगम या कांतम मिलाओ, ये इसके साथ बहुत अच्छा रिजल्ट देते हैं. सो ऐसा हर एक कंडीशन के अनुसार मेन ड्रग प्लस एडिशनल उपद्रव व्याधियों को जो ड्रग मिलाना, ये प्रैक्टिस में बहुत अच्छा रिजल्ट देते हैं. देखो आजकल तो पेशेंट लोग जो आते हैं उन लोगों को फास्ट क्विक रिजल्ट चाहिए. लोगों के पास ज्यादा टाइम नहीं है, ज्यादा मनी नहीं है, उन लोगों को जल्दी फटाफट रिजल्ट कैसा देगा? अच्छा है, सब बहुत सारे ड्रग है, इसलिए 2 ड्रग्स या 3 ड्रग्स को मिलने में कोई गलत नहीं है. इसलिए मैं ऐसा कॉम्बिनेशन आपको बता रहा हूँ जो हमने कोटेकल में ट्राई किया है, वो नॉलेज जो है आपको दे रहा है, आपका प्रैक्टिस में फलदायक है. एंड पुअर पेरिस्टाल्टिक मूवमेंट है, डायबिटिक कोलोन का न्यूरोपैथी में आता है, कोलोन का मूवमेंट बहुत कमती है, इसलिए कॉन्स्टिपेशन जो आता है आजकल हमारा लैक्साकोट बहुत अच्छे रिजल्ट देते हैं. वो सब डायबिटिक रिलेटेड कॉन्स्टिपेशन में ओल्ड एज में जो कॉन्स्टिपेशन आता है उसमें बहुत अच्छा रिजल्ट दे लैक्साकोट. वैसे धनवंतर कृतम के साथ वैश्वान चूर्ण मिला के दे दो, वो भी अच्छा रिजल्ट देते हैं. वरना तो धनवंतर कृतम के साथ 2 चम्मच एरंड के तेल मिलाओ, अच्छा कॉन्स्टिपेशन छोड़ के अच्छा कोलोन मूवमेंट इंप्रूव होता है. And even I tried in high creatinine and urea with Gokshura Churna, Shilajit, Abra, and Valiya Marma Gudika. It's giving very good result in high creatinine and urea. And next is the Sukhaprasavada GRITHA. This is a special product of Kottakkal Ayurveda. You cannot find this yoga with any other company. Our senior doctors, after doing so many clinical research, they have started manufacturing this yoga. The seniors got this yoga from the Parampara family, Ayurveda family, Ashtanga family, and everything. So Ayurveda Shala started manufacturing this product from the time of PS Warrior onwards. So very few 2 drugs only. You see, Sorasa of Ubodiga, Bacilla alba, that is the green drug, and belongs to Bacillus family. Malabar spinac, Uruvaru phalam, Malabar cucumber. This Ubodiga or Bacilla alba is widely used as a vegetable. You can get it in Bombay Matunga market and everything. All the vegetable market you use. We make dal plus this thing or sabji type of all these things, or some people use prepare thepla type of preparation. Anyhow, that is having medicinal value in it. And this Malabar cucumber is very commonly available all over India. And this is very good during the pregnancy. That too, from the 6th or 7th month onwards, you have to use. So most probably the lady will get a Sukhaprasavada. That is, there will not be any complication of the delivery, and most probably normal delivery also. That is the main thing, property of this yoga. Only during pregnancy, 6th or 7th month onwards, we recommend. The 3rd month onwards, you can start giving Dadimadi Grida, Kalyana Grida, etc. And the 6th or 7th month onwards, switch over to Sukhaprasavada Grida. So, in Bacilla alba is effective in anemia, mouth ulcers. It is rich in proteins, iron, calcium, vitamin A and C, good in reducing the malnutrition. It is one of the best antioxidant and hypoglycemic drug with more vitamin C, gastroprotective. It heals the ulcer of the colon, gastric ulcer healing, best anti-inflammatory, and it is slightly laxative, increases the body's testosterone level in males and libido also. It is low fat, low cholesterol, good for heart and weight management also. So the cucumber, it contains more vitamin A, C, A, antioxidant, magnesium, phosphorus, potassium. It promotes cardiac health and good for eyes and skin. So that's why this combination is widely used as a Gritha yoga in Kerala. But to Kotakal preparation is super. And next is the Saraswata Gritha, which you people are very familiar. See, it is containing Haritaki, Vyosha, Panda, Vacha, Shikru, Saintava, and Shira in it. It is told that it improves Vak, Methas, Smriti, Buddhi, Karth, exclusively for that only. So that is very useful. School going, college going children, on those who are preparing for the entrance coaching, engineering entrance, IIT, ITI, or medicine, and they should use it regularly. और 2-3 महीना 4 महीना तक कंटिन्यू यूज करना है. 10 ml रात को सोते वक्त गर्म पानी के साथ, गर्म दूध के साथ यूज कर सकते हैं. और बच्चों को जो स्पीच रिलेटेड कुछ प्रॉब्लम है तो लोगों को भी दे सकते हैं. एडीएच टाइप जो डिसीज है, हाइपर एक्टिविटी है, इसमें सब यूज कर सकते हैं. इसी के लिए हमारे पास कल्याण का घृतम है, महाकल्याण का घृतम है, ब्राह्मी घृतम भी है. वो सब ऑलमोस्ट सेम कंडीशन में यूज करते हैं. बट ओनली थिंग ये तो है ना वाक स्मृति बुद्धि कृत, exclusively for that only this is effective. The yoga of Saraswata Gridam differs from Saraswata Churnam and Saraswata Arishtam. वो तीनों अलग अलग योग है. Saraswata Arishtam अलग है, Saraswata Gridam अलग है, Saraswata Churnam अलग है. वो Saraswata Arishtam में 21 ड्रग्स है, चूर्ण योग में भी डिफरेंस है. सूर्णादि घृतम, अब मैं सुना ये सूर्णादि घृतम के बारे में. Suranadi Gridam is a main indication in his all type of anorectal diseases. Kashaya of Vanasurana, etc., 12 drugs, Panchakola, etc., 21 drugs as a Kalka, and the Sorasa of Matulunga, Ardrak, Aridra, Changeri, milk, and Takra. So, exclusively for anorectal diseases, maybe Bhagandara, maybe fissures, maybe arshas, or ulcers, or polyp, or wound, and all these things. So इंक्लूडिंग द IBS टाइप ऑफ कंडीशन ऑल्सो, ये तो बहुत अच्छे रिजल्ट देते हैं। रोज खाली पेट में वो दे सकते हैं और चिरुलो आदि कषाय के साथ दे सकते हैं और रात को सोते के वक्त भी ले सकते हैं। उसमें जो दवाई है वो सब दीपन पाचन है, अनलोपन भी है। बट विरेचन तो नॉर्मल होता है। ज्यादा विरेचन के लिए आपको इसमें पालंडव एरंड तैलम मिला सकते हैं। पालंडव एरंड तैलम कोटकल का प्रोडक्ट है, वरना तो आपको खाली एरंड तैल इसके साथ मिला के दे दे तो भी अचीव होता है सेम रिजल्ट प्लस नॉर्मल मोशन। और कोलाइटिस, अमीबियासिस, उदावरता एंड गुल्मा, जिन लोगों को उदावरत जो गुल्म के टाइप आते हैं, पेरिस्टाटिक मूवमेंट डिसऑर्डर्स, कोलन मूवमेंट तो ठीक तरह से नहीं हुआ, और डाइवर्टिकुलाइटिस टाइप का कंडीशन में बहुत अच्छे हैं। एंड एनोरेक्टल स्पैसम, एनोरेक्टल स्पैसम है, एंजाइटी रिलेटेड भी शायद हो सकता है एनोरेक्टल स्पैसम। और बार बार टॉयलेट जाने का इच्छा, फ्रीक्वेंट टॉयलेट जाते तो नहीं, स्टूल पास नहीं होता है बट जाने का इच्छा, ये एंजाइटी रिलेटेड है। इंटरव्यू के पहले और जॉब जाने से पहले और बाहर घूमने जाने से पहले सब बहुत लोगों को ये प्रॉब्लम है, एनल स्पैसम है, तो जाने का इच्छा। लोगों को ये रेगुलर यूज करने से बहुत अच्छा रिजल्ट है। सो पोस्ट सर्जिकल एनोरेक्टल सर्जरी कंडीशन में वो जो प्रॉब्लम्स आता है गैस का, मोशन का, ये सब कंडीशन में सूर्णाधिकृतम बहुत अच्छे रिजल्ट देते हैं। फलसर्पिस, फलसर्पिस जो है ना, स्त्री रोग में बताया अष्टांग हृदय में, इसमें कषाय नहीं है। मंजिष्ठा, कुष्ठदगर, त्रिफला, वचा, निशा, दारुवी, मधुगा, मेधा, दीप्यगा, कटिरोगिणी, पयस्या, हिंगु, काकोली, अश्वगंधा, शतावरी, इसमें शुगर मिलाता है। जिन लोगों को वेरियस टाइप्स ऑफ योनि रोग है, योनि दोष है, शुक्ल दोष है, दैट इज बोथ मेल एंड फीमेल सेक्सुअल रिलेटेड रिप्रोडक्टिव सिस्टम रिलेटेड प्रॉब्लम्स है, बोथ मेल एंड फीमेल रिप्रोडक्टिव सिस्टम रिलेटेड प्रॉब्लम में बहुत अच्छे रिजल्ट देते हैं। When I was practicing in Chennai, I come across a prescription of a one leading gynecologist, expert in infertility management. She used to recommend the Phylloserpes for all her patients, both male and female. And the result was good, she was telling, good result, both male and female. And Mriyamana Praja, जो जिन लोगों को फ्रीक्वेंट मिसकैरेज होता है, अबॉर्शन होता है, मोस्टली सेकंड मंथ, थर्ड मंथ, फोर्थ मंथ फ्रीक्वेंट अबॉर्शन होता है, लोगों को रेगुलर यूज करने से यूट्रस का जो स्ट्रेंथ है, यूट्रस का मसल्स जो एक्सपैंड हो जाता है, वो सब अचीव होता है। So this is also very effective. Frequent miscarriage and abortion. हमने म्रियमाण प्रजा, that is the only indication told in the Shastra. And generally good for during pregnancy also very well you can use. That is why in those who are having the abortion miscarriage complaint, they have to start from the first month onwards till fourth month and fifth month. Then they can switch over to the Sukhaprasavada. And it is Ayushya, Pushtida, Medhya, Pumsavana. And for the children, it improves the body strength, vitality, and metabolism. So those who are not used, please try it. And more, there is not much pathya. Right? Normal lifestyle जो carry होता है, and you can eat everything. And only thing, take 10 ml or 15 ml every day morning with warm milk. Those who are having diabetes, try to avoid. Mishraga Sneha. This is one of the powerful Virechana Dravya. Mishraga Sneha. गुन्म चिकित्सा में बताएं मिश्रक स्नेह, इसमें बहुत सारे दवाई है, पिप्पली है, आमलगी, द्राक्षा, श्यामादिगण, and 21 like 21 drugs, and Japan, श्यामा दंदी द्रवंदी कमुक वचा, And what is the Balashtuti of the Shyamadhigana? Shyamadhyo handi gunmam, Visham aruji kapam, Hridrujam mutra gracham. One of the best Shodhana Gana. And because of the presence of the Jayapal, it is more powerful. Again, milk is there and air and the thaila is there. So the main effect use is for the severe constipation, any type of constipation. I would like to tell you one thing. Kottakkal Ayurveda is running a cancer OP in our main Kottakkal, Kerala. The only cancer OP in entire India for exclusively for cancer management. We are getting patients from various parts of India. Maybe after surgery, before surgery, chemotherapy, all these things. So the constipation was a common problem among the chronic cancer patients. The pain and palliative center is there in Calicut Medical College. We were also a part of that pain and palliative. The doctors, modern doctors, called all the system of medicine to help them. So we were also, Kottakkal was also invited and we were also going there. During that period, the doctors come across a morphine-induced constipation in cancer patients. Morphine is given for the management of the severe pain. They don't have any other medication. So, but this regular use of morphine will leads to constipation. They don't have any medicine. They asked us, what is your medicine? And our doctors sat and discussed and finally concluded that we have a product like it, we can very well use. So they told that you forget about the ingredients and everything. If it is giving good result, we will accept it. And they started a double-blind study of the Sneha. Research, double-blind study. Either the doctor and either the patient will not be knowing what he is taking. So the result came with a fantastic result. Most of the patient got very good relief. The constipation reduced with the regular use of Sneha. The article has been accepted by the international scientific bodies, medical bodies, and published in various medical journals. You see, if there is an effect, anybody will accept. Any doctor, any system, any party, any country, but it should have a proper documentation and we should be able to show the result. This is one of the best examples. And that's all about this Mishraga Sneha. And again, Gulma, Vruddhi, Vidrathi, Udarashula, Vatavyadi, etc. we can very well use. Regarding the dose of Mishraga Sneha, Dhyan Rekhana, 5 ml in the beginning, switch over to 10 ml, maximum by 15 ml itself, the patient will get a very clear motion. Rasnadi Gritham. Rasnairandabala Sahachara Viditu Sparshava Shamrada. Anybody can remember this yoga? Please try to recollect. Rasnairandabala Satavari. This yoga is nothing but Lakhu Rasnadi prepared by Kottakkal. Rasnairanda Kwadam tablet also, same yoga. This ghritas is used once the arthritis, Amavastha is totally gone and Kevala Vatavastha. That too with more pain. Shuladhika Vata Roga. Especially Shula of the Janka, Uru, Trika, Pritta, Parsha, Hanugam. Pain of all these things. Please remember, if the association of Amavastha is there, please don't use yoga. Amavastha totally eradicate होने के बाद वातव्याधि चिकित्सा में आर्थराइटिस में रेगुलर यूज के लिए ये शूलाधिक वात रोग अवस्था में ये हमारे रासनाधिकृतम बहुत इफेक्टिव है. You don't have to give so many medicine. Rasnaधिकृतम morning and night one medicine, minimum medication. And Shobhak Avastha also, where there is not much Ama association, you can very well give Vatavyadi and Vata Shodhita is very, very effective. शतधौत घृतम, इसमें क्षीरित्व कषायम प्लस घृतम है। इसका इंडिकेशन जो है वादरक्त रुजापहम विदाह ताप संप्लोष शोफा तोदा एंड पित्त विसर्ग। दाहे सहस्रधौदेन सर्पिषा अभ्यंगमाचरी, दाहे सहस्रधौदेन सर्पिषा अभ्यंगमाचरी, पैत्तिक ज्वर चिकित्सा में अष्टांग में इंडिकेट किया है। विसग्रंथिश्च पैत्तिक विसर्प में विसग्रंथिश्च लेवस्यात् शतधौत घृताप्लुता, पैत्तिक विसर्प मैनेजमेंट में जिन लोगों को एनोरेक्टल ब्लीडिंग हो गया है और भगंदर की व्रण हो गया है, if there is a burning sensation of the anorectal area, you can very well give this Shatadhauda Ghritam. And anorectal muscle tear, due to the chronic constipation, anorectal muscle tear हुआ है और फिशर टाइप का सिम्टम हो गया, बर्निंग सेंसेशन है, आपको ये Shatadhauda Ghritam लगा सकते हैं। एंड पोस्ट सर्जिकल और पोस्ट डिलीवरी कंडीशन में विजेना में जो अल्सर्स है, स्किन रप्चर है, ये सब कंडीशन में दे सकते हैं। उष्णपिटिका जो है उसमें भी दे सकते हैं। बच्चों को जो क्रोनिक कॉन्स्टिपेशन है, ये लगाने के बाद मसल थोड़ा रिलैक्स होता है, लोग को ऑटोमेटिक नॉर्मल मोशन होता है। सो रिगार्डिंग दिस Shatadhauta Ghritam also we have done a very good study. Again, in the pain and palliative center in Calicut Medical College, they were telling that after the chemotherapy or medications and everything, radiation, some case or radiation, everything, mouth ulcers comes for the patients, maybe due to various reasons. There is no promising medicine in the modern medical system. So they requested us, what is your solution? We suggested the use of Shatadhauta Ghritam inside the mouth daily 2 or 3 times. Wonderful result. This was also done in the double-blind study method, and results were accepted by various faculties of Cancer Management Association and published in international journal. Again, you see, if there is result है, तो वो लोग accept करने को तैयार है with proper research report. They are not concerned about the ingredients and everything, but it was an excellent study, I should say. Charneria Ghritam. Why I am telling all these things, Charneria Ghritam, you may not be quite aware. This is one of the promising drugs for the IBS related diseases, ulcerative colitis and IBS related problem है। इसमें जो चार्गेरी सोरसम है, मधुका उत्पल एक्सेट्रा कलकर द्रव्य है, it is a त्रिदोषजित, it is arsha adhisara. Adhisara is the only word has been used, but wonderful result, including the arsha's management. तो उन लोग का spasm type का जो pain आता है after the surgery also, regular use of Charneria Ghritam is indicated. Pandaroga, Jara, Aruji, Mutragracha, Gudabhramsha, rectal prolapse जो है, maybe due to the various conditions of muscle weakening and everything. Bastyana, bladder distension. Again, it is very, very effective. Pravahana, Pichasrava, Arshashula. So you see, Atisara, Pravahana, Pichasrava, Arshashula, Bastyana, Udabhramsha, all are anorectal related problems. Any type of conditions, we have got a very promising drug, Charneria Ghritam. Friends, please try to use morning before food only. Okay. And next comes the Jatyadi Ghritam. Jatyadi Ghritam nowadays is available in the form of 50 gram pack, 200 gram pack, and Jatyadi Keraliya also available with the Kottakkal Ayurveda. All are effective. The ingredients are Sorasa of Jatipatra, Nimbapatra, Patolapatra, and Kalashaka. Kalka, Daruvi, Nisha, Sariva, Manjishta, Abhaya, Tukta, Yeshtimatu, Nakta Kavija, and Patrabhaga, you have to add Siktha, that is copper sulfate. Any type of Vrana, you can use. Let it be chronic ulcers, diabetic foot, or unknown reason, any wound, you can very well use. So one of the best promising drugs. So many modern doctors here in Kerala accept the efficacy of the Jatyadikritam in the wound management. Wound management, how many times you had put this Neosporin and everything. First, you wash that area with the Tripala Kadakashaya or Arakutha Kashaya. Clean it thoroughly and apply Jatyadikritam over that one with the sterile cotton. Nimbattu Kashayam also you can use for washing. Or Panchavalka Kashaya also you can use for washing. Similarly, Yeshtimatu the Kashaya also you can wash it. But after the wash, thoroughly, strictly remove all the waste material in and around that wound area. Then you apply the Jatyadikritam over it regularly. 100% guarantee result. Vrana, Sukshma Vrana, Dushta Vrana, Marma Ashrida Vrana, and Sravi Vrana, Gambhira Vrana, Ruja Vrana, Nali Vrana type. And it is a Vrana Shodhana as well as Vrana Ropana. One of the best medicine the OP level use, and even the ulcers and fistula also very well you can use. If you add Tankana into this yoga, it will be more effective. Tankana Basma with Jatyadi Krida. And last Gana in this yoga is Naladadikrida. Naladadikrida, very few doctors only write. It is containing Shankapushpi Swarasa, milk, the Tamanji, Katirohini, Payasya, Ishtimatu, Chandana, Sariva, Vacha, Trifala, Trikatu, Dveharidra, Patola, Saindhava. It is one of the best drug of selection for the Dr. P.K. Warriors in the management of the stroke. Stroke cases after the modern medications and everything, they come to us. Still that paralysis shock effect is not gone. In such condition, he used to recommend this Naladadikritam every day morning, 15 to 50 ml empty stomach. And after complete digestion of the ghee, lunch only. Regular use with the other Stylasega, Abhyanga, Potli massage, whatever you want to do, including Vasti also. So many cases that too in the early stages of the immediately after the stroke, not old cases, found to respond, not 100%, but better result. Naladadikritam. It is good to improve the speech, vocal cord ability, and Srutadhari, that is improves the memory, improves the other brain faculties and artistic talents and everything. So Naladadikritam is also effective. I used to give this Naladadikritam for the Kampavada, Parkinson's type of tremors. Not exactly. Parkinson's similar type of Kampavada. If it is a Pakka Parkinson, you can think about Kalyana Gridam, Maha Kalyana Gridam, or Dhanandara Gridam. It is a mimicking tremor, senile tremor, other tremor. This Naladadikritam is bound to be very, very effective. So, friends, almost all of the yogas I covered.